Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Terry Hush. Now, Terry is a healthcare futurist and also co-founder and CEO of Roji Health Intelligence. She's joining us here to talk about how consumer-focused initiatives will greatly expand in 2022. Welcome to Health Professional Radio. Terry, how are you?
Thanks so much, Neil. I'm doing great.
Give us a bit of insight into what a healthcare futurist does.
Well, a healthcare futurist connects the dots and looks forward into what's going to be happening down the pike for healthcare, and does so with a command of the information from the past, looking at some of the trends that we see coming up and seeing what has worked in the past and which way consumers and healthcare systems are veering.
Consumer-focused initiatives. Explain what a consumer-focused initiative is as it relates to patient outcomes when it comes to pharmaceutical costs and things of that nature.
Consumer-focused initiatives are designed to address a growing consumer movement in healthcare where patients, and not just, and that includes a broader category of consumers, are shopping for their services. They want to be in charge of decisions. They're working on applications on their phones to help them get fit. They're collecting their own information. They're seeking information online. And they have empowered themselves with data and information. And they're kind of challenging the status quo of healthcare providers right now.
Well, I was wondering if this empowerment had to do with these tons and tons of information that would be required to empower oneself in such a way. Is this something that has just recently been readily released by providers and payers?
It's not really released by providers and payers. They're finding information on themselves. They're now following apps on their phones to follow their heartbeat, their blood pressure, their fitness levels, their steps, their falls. They're looking at their conditions, their calories, their glucose sugar, their oxygen. They're looking at all these values, and they're seeing a different picture of health than what they're getting from the traditional healthcare system. So what's happening is that this information is starting to grow side by side with the information they're getting in much smaller number of encounters from their own providers. So some of consumers don't even visit providers. They're getting all the information that they need on the internet or through these apps, and they're deciding what's serious enough to go to a provider for. So you have this kind of siloed effect of consumers who want to manage their own care or their own bodies at this point and decide for themselves what's serious or not to be addressed by the official or traditional healthcare system.
Does this trend indicate a lack of trust or an eroding trust in the provider, in the payers, in the system as a whole?
Well, I think it's partly related to that. It's growing side by side with a lack of trust. So it's becoming intermingled with that. So I think you find, especially during the pandemic, a lot of consumers and patients could not even reach their providers and didn't have available options for getting services. And so they managed to do it on their own. And at the same time, the traditional healthcare was awfully busy managing the pandemic, but weren't really sending out messages to consumers about what they should do if they had symptoms of COVID or where they should get tested. So the patients were kind of left on their own. And these two things started to grow, both the consumer movement, where patients were, at least a group of patients, were becoming more literate and going it on their own, and then a decline in trust in the official healthcare system.
Now, it seems like a positive that people are taking control of their own healthcare, as it were, and as you say, deciding, what is important enough to actually take the time and the expense and the risk to go and see a healthcare provider. But what are some of the consequences? Are there any downsides to the health system as a whole when patients are more independently managing their own health and risk factors instead of using the traditional system?
Well, there are big consequences for the healthcare system. For one, all of this data that consumers are keeping on their own isn't captured by the healthcare system at all. So for those consumers who are actually patients with chronic disease, for example, none of that activity level, none of the health data is viewable by their own providers. So the providers have a limited view of what's happening with patients and are making decisions about treatments without knowing that information, or even that the patient is committed along a certain path of healthcare. I think the other issue is that if consumers are handling the smaller scale issues on their own and they're going to minute clinics or CVS and Walgreens for checkups on rapid health issues, then the healthcare system as a whole deals only then with sicker and sicker patients. And in a situation where value-based care is intensifying, that will really drain the bottom line.
So how do we connect the consumers that are managing their own healthcare, their own vital statistics, going, as you say, to CVS and minute clinics, to the providers who would really love to get this information and be able to more effectively treat their patients as opposed to not knowing what the patient now knows?
Well, the first thing that needs to happen is that the providers need to understand that this is going on and broaden their consumer strategy. So a lot of providers are still having more of a paternalistic attitude towards their patients and not really adopting consumerism kind of focused policies. There's still the old waiting in the waiting room phenomena. There's a lot of inconveniences for patients. But some providers, especially more entrepreneurial, are really beginning to look at not only broadening their outreach to consumers, but figuring out ways to capture that data. They would like to do that, and there have been a number of experiments with different organizations beginning to work on particular conditions with the capture of activity levels and exercise and so on, as well as other kinds of health habits consumers are having. So it's a huge opportunity for healthcare to begin rethinking how it converses with the broader community of consumers, not just their own patients who are kind of flitting in and out of their settings.
So it seems as though the bottom line is incorporating ways to listen to the patient as opposed to, as you say, going by the traditional mindset, that maternal mindset with the patient, because a lot of patients have a problem trusting physicians anyway, because they think the physician is so much smarter than they are that anything that they say might be just overlooked or, in one ear and out the other as far as they're concerned. But I do believe that the bottom line, what the takeaway is more physicians should start listening to the patients and simply not dismiss what the patient brings to the table as far as what they've found about themselves.
Absolutely. And the health system, who generally employs most of the physicians at this point, really needs to help those physicians understand and appreciate how the data that the patient is bringing can be used, and to give the physician eyes on that. It has to be incorporated in some kind of technology that is going to provide the full scope of what's going on with that patient. For example, obesity is driving so many bad outcomes right now, and is one of the biggest poor indicators of prognosis under COVID-19 even. So, but if physicians don't know what their patients are doing to manage their weight or activity levels, then it's really difficult for them to make a coordinated plan with their patients that the patients can adhere to. So that data capture and integration is an essential part of this whole conversation. It's not just talking during the patient-physician encounter.
Well, give us a website, if you would, where we can learn more about Roji Health Intel.
It's rojihealthintel.com, and that's ROJI Health, INTEL.com.
Terry, I appreciate you taking the time out this evening to give us this information. Hopefully we'll speak again.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Terry Hush, healthcare futurist, co-founder and CEO of Roji Health Intelligence. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.